Thanks for joining us. Appreciate you being with us, and happy to welcome our next guests this morning. Dr. LouAnn Woodward, you know her as Vice Chancellor of Health Affairs and Dean of the School of Medicine at UMMC, and also Dr. Alan Jones, who is Associate Vice Chair of Health Affairs at UMMC. Good morning to both of you. Thanks for being with us.
Good morning. We're glad to be here.
Good morning, Richard.
So, an exciting time of the year on college campuses and medical school campuses as well. We're in that time where graduations are happening. Does the timeline, does it line up with med school graduation also being in May, or is that an August graduation?
So, our graduation is also in May. We have our annual commencement ceremony at the end of May each year, and we're looking forward to it. We're getting geared up and ready to go.
Dr. Jones, when you look at those young graduates walking across the stage and you know what has gone into getting this far, but also knowing the road that is still ahead, what are the thoughts that run through your head as you see those students walking?
Well, the first is we're extraordinarily proud of all of them and their hard work. Whatever the health profession is that they're training in or have studied in, they are launching a career that is a long career, hopefully. And, we know that when they leave, they're prepared, but they got a lot more to learn. Medical students then enter into residencies. Residencies can range from 3 to 7 years, and that's another time of intense training. So, this is the beginning of their journey, really. You'd think school is, but really after they finish school is the beginning of their journey in health professions.
Dr. Woodward, I think we've talked about this before. What you love to see, what UMMC loves to see is students who train here and then choose to work in Mississippi as well. What is that percentage, at least from a ballpark, of your graduates that ultimately choose to stay and practice in Mississippi?
So it varies a little bit from school to school. The school that I've got, kind of at the top of my brain, the number zone that I am the most familiar with would be the medical students. Mm-hmm. But what we know is the truth is if they go to medical school here, and again, we only take Mississippi residents, we've talked about that before,
right.
And then they do that next phase of their training that Dr. Jones was mentioning, if they do their residency training in the state, then we have the greatest chance of keeping them in Mississippi ultimately to practice. When they go out of state, we don't get all of them back. Even
Sure.
with the best intentions, about half of them come back. At the end of the day, if you look 10, 15 years out, we have a retention rate that ranges in the 65% range, really, sometimes a little bit lower, sometimes even a little bit higher. There have been some years when we're tracking that we've got a 70% retention rate. But for a good average number, I would say about a 65% retention rate for the medical school. Now, the dental school also only takes in-state students, and they also have a great retention rate. Yeah. And some of our other schools take students from out of state, but might have a preference for Mississippi residents. So whether you're looking at our physical therapy program, our nursing school, et cetera, really across the board, we have a higher than national average retention rate of our graduates practicing in our state. And as of yesterday, the number might change between now and the end of May, but as of yesterday, we have 963 graduates that we will have walking across that stage here at the end of May going out to practice in Mississippi, so we're excited about that.
Hopefully that number doesn't go down. Hopefully there are a few that they got that last test score that they needed, and they're going to get to walk as well.
Until it's final, it's never really final. So anyway, that's the number we're working with as of now, and like you said, I hope that's our number there at the end of May.
Quite literally educating the future health professionals in Mississippi, and we know that it's so necessary. We've talked about doctor and nursing shortages, but the other side of this is it's not an easy undertaking financially to go through medical school or to go through a PT program or dental school or even nursing school. Is the payoff still there? We've heard so many doctors that talk about how the medical field has changed and how it's hard to make a living and it's hard to fight with it. Is the payoff still there ultimately for those that choose to go down this long and difficult road?
So I would say 100%. If you are doing it for the reason that you want to make a difference in people's lives and you want to take care of patients, absolutely. If you're looking for an easy career where you make a lot of money and have no hassle, well, that would not be it. But if you are driven by the right things, then it's absolutely worth it. And I want Dr. Jones to talk about some of our workforce scholarships, but when you look at our tuition, and we do every year, we look at our tuition, we compare it to the Southeastern averages, we compare it to the national averages. We keep our tuition in the lower part as far as medical school, dental school, all of our professional schools. And we've got data that shows our students graduate with less debt than is the national average. And we work hard on that. We have the Mississippi Rural Physician and Dentist Scholarship Program, which the legislature supports, which is fantastic. And then we have some of our own workforce scholarships that I'd like Dr. Jones to, speak to.
Please do.
Yeah, we have scholarships that we offer at UMC for students that choose to stay in our health system and work within our health system. We have scholarships available for each semester that they want the scholarship. They just repay us in time as an employee.
Hey, forgive me for interrupting just for a second. That means something different than it did just a few years ago as the footprint of UMMC is growing across the state, right?
Right. We have a lot of options for where they can work. We have facility in Grenada. We have a facility in Holmes County. We have facilities here in Jackson. We have clinics that are scattered all throughout the state. And we offer those workforce scholarships to employees that want to work anywhere in our facilities.
Fantastic. So are there options beyond the stay and work within the UMMC footprint in terms of scholarships?
Yes. There's a large number of scholarships that are offered through our institution. Some of them require you to, like Dr. Woodward mentioned, the Rural Physician Scholarship, for example. That requires you to repay some time in a rural area. Generally, you would choose that area as you're going into that scholarship. So some of them have specific requirements, but some of them don't. It just depends on who the grantor is of the scholarship and what the particular nuances of how you're supposed to repay that debt.
Visiting with Dr. LouAnn Woodward and Dr. Alan Jones from UMMC. Dr. Woodward, the Dean of the School of Medicine, and Dr. Jones, Chancellor of Health Affairs, Vice Chancellor of Health Affairs at UMMC. So much going on. And I'd like to talk as we move forward about some of the specific areas where growth is happening. One of those is kind of within the psychiatric unit. And I'm curious, and we've only got 30 seconds, so this is not fair. Maybe we can just kind of start the conversation here. How future plans for the psychiatric unit and the incredible development that's going on with the Mind Center, that's the right name, I think the proper name of it. How those units are working together and what's happening there. Because we know so many people are dealing with a lot of mind-related issues, mental health, how all of that ties together. We'll continue our conversation. Dr. LouAnn Woodward, Dr. Alan Jones from UMMC. It's Mornings with Richard. Mississippi. On Saturday morning, Garden Mama will be on the road at the Tupelo Farmers Market at the Depot. That's in Tupelo. The Tupelo Farmers Market at the Depot has locally grown vegetables, fruit, honey, flowers, and so much more. Garden Mama will be there. Lance will be in the studio, and we hope you will join. More coming up with Dr. Woodward and Dr. Jones after this. Mornings on SuperTalk Mississippi. Mississippi. Doctors LouAnn Woodward and Alan Jones are my guests, both from UMMC. And before the break, I kind of teed this up. The plans for the psychiatric unit, that is certainly something that is of importance at UMMC right now. And then the Mind Center, which is, I guess, fairly either recently opened or been upgraded, and there is a significant fundraising effort that's going on for that particular. Dr. Woodward, can you talk to me a little bit about those two entities in particular and maybe how they're working together?
I'm going to touch on that a little bit and then pass it off to Dr. Jones because he's kind of leading the charge on some of that. But so the Mind Center has been in place for a long time, and they are fundraising to increase their clinical footprint and be able to see more patients. They see a lot of patients with dementia and all types of Alzheimer's and other degenerative diseases like that. So a lot of that does overlap and cross over into mental health and behavioral health. And we've been working a lot, for a variety of different reasons in the last few years. There's been sort of an uptick in the need for behavioral health services. So we have been working a lot to expand our services and to be able to have some different facilities. One of those is an adolescent psych facility, and then also to increase really and to, in a way, establish a new psychiatric emergency services facility. So I'm going to ask Dr. Jones to give you a little bit more on both of those.
Sure.
Yes. So we have, offered for quite a while a comprehensive platform of psychiatric and psychologic services for children in the Center for the Advancement of Youth, which is an outpatient facility. The gap that has been there has been more on the inpatient side when a child or a teenager needs to be admitted into the hospital for a psychiatric reason. We do have a child unit, but we try not to intermingle kind of the older adolescents with the children because they have different needs, and then it's also difficult to intermingle the adolescents with the adults. So what we're building for the first time is a adolescent unit where children, between the ages of around 14 to 18 that need some type of inpatient mental health services will be able to have those specific needs met on an inpatient basis. And it's that we know of the only dedicated adolescent unit that will be available in the state of Mississippi. And then we're also, in conjunction with that, building a area between our adult and pediatric emergency departments that will be an intake facility for emergencies related to mental health, so that it is a safer environment. They can be observed. These patients can be observed for a little bit longer period of time to determine if they will need inpatient or outpatient care, exactly what needs to happen, and it can service both children and adults. So we're excited about those because the number of mental health problems, particularly emergencies that we're seeing that need inpatient care, is just rising, and we expect that it will continue to rise over the next years.
The delineation between the youth center and the adolescent center, I mean, as simple an explanation as you don't put second graders and 11th graders in the same school building?
That's pretty much, you got it.
Okay. That makes sense. What about the Burn Center?
Well, the Burn Center is open. We opened it just last week, so we're really excited about that. It is a unit that is dedicated just for the treatment of patients with burns. It is available to both children and adults, and it's got a full complement of services from ICU care to step-down care. It can offer med-surg care, which is the lowest level care in a hospital. We have outpatient facilities where they can do rehabilitation. We have specialized wound care facilities where minor procedures can be done. And all of the staff, physicians, everybody that work in that unit are specifically trained to treat patients who have burns. So it is.
Forgive me for an ignorant question, but is there a particular type or age of burn that you see the most of? Like, I mean, is it house fire related or car accident related or kids have fireworks go off in their hands related? Like what are we looking at?
Yeah, that's a great question. Most of the burns that we see are minor burns. They come into an ER, they have got hot water on their hand, on their arm, on their face. Most burns are treated on an outpatient basis.
Okay.
When they reach a certain percentage on their body or a certain degree of severity is when they require inpatient care, and that's what we're talking about here is more the inpatient side. We see a spectrum of burns on the inpatient side, everything from house fires, car fires, to just significant burns from, say, oil splashing when somebody's frying a turkey, or an elderly patient gets
you put the frozen turkey in the deep fryer,
exactly.
and you got the rocket launch. Okay.
Happens a lot.
I feel like Instagram instructs us enough not to do that we should be able to eliminate that particular one.
Well, you would think, but it also instructs you not to hold a firework, but people still do it.
Probably should raise my hand there. I mean, bottle rockets just work better when you throw them, and it's more fun. So.
I'm not going to argue with that.
Not advocating that we should go down that road. Visiting with Dr. Alan Jones, Dr. LouAnn Woodward from UMMC. You're expanding or have expanded into Madison County, and if I'm not mistaken, that includes purchase of Merit Health recently. Is that part of that expanded footprint that we're talking about?
It is. So we've had a lot going on lately, and if you look at a map of the locations where we have clinical services, our range goes across the entire state, literally from Tupelo to Gulfport, Greenville to Meridian, and everywhere in between. We've made up a few graphics on that, and the dots where our hospitals and clinics are all over the state. Most recently, this spring, we've had a lot of excitement from the fact that we've had 2 locations in the Madison County area that have opened. We did, as of May 1st, assume ownership of what was formerly known as the Merit Health Facility out in Madison County. We're now calling it UMMC Madison. And then we had a ribbon cutting just last week, I think it was, or the week before, for the Colony Park South location. That's what we're calling a new outpatient clinic facility that we have leased there in Ridgeland. So we've had a lot of good days lately.
When you purchase or assume control of another healthcare entity, how do you integrate their staff with your staff? Do those people stay on? Is it new employees? How does that work?
So it depends on the entity. With the Colony Park South location, those are clinics that we moved in that location that expanded. So most of the people at Colony Park South are now working there and used to work, for example, in the pavilion on the main campus. So a lot of those employees just changed locations. With the Madison Hospital, thankfully, we were able to hire over most of the employees that worked there under the Merit banner. So, we wanted to keep on most of the employees that worked there, and luckily we were able to do that. So it was a very seamless and smooth transition. We expected a few bumps in the road, as you do with any time you kind of start something new, but amazingly, it went very smooth.
Last thing that I think we've got time for today, and this is I think it kind of speaks to the business side of UMMC. You talk about the expansion, whether it's burn center or enhanced psychiatric services, or the enhancements to the mind center, or all the different things that we've talked about, the new clinic locations. Are these happening because of need, because of business opportunities that UMMC sees to help the overall financial picture of the hospital, kind of a combination? How is that happening, and why is that happening?
So all of the above, and it depends on the circumstance. So, I mentioned we've got partnerships in Tupelo and Gulfport and Meridian and Greenville, and if we sat down and kind of looked at specifically what are we doing in those communities, it's very different in each one of those. The clinics that we're offering, the way that we may be partnering with the hospital there, the services we're providing, it depends on what that community has asked us to do and how they've asked us to help. So our overall tagline is improving the health of Mississippians and the health of Mississippi. So it just depends on the situation, what we're doing. But our clinical footprint's growing, our schools are growing, our research mission is growing, and at the end of the day, we're working toward that, healthier Mississippi tagline.
Sure.
So it's different in every circumstance.
I said we were out of time. Can you guys hang for just a couple of more minutes? Just one or two other things I want to ask you about before we get out the door.
Sure.
We'd be glad to, yeah.
Dr. LouAnn Woodward, Dr. Alan Jones from UMMC, joining us on Mornings with Richard Cross, SuperTalk, Mississippi. Quick time out. We'll wrap up the 7 o'clock hour with you. Coming up next. Had a guest on yesterday, Chief Randy Tudor. He is Pontotoc Police Chief, and he's the president of the Mississippi Association of Police Chiefs. And we're asking him about legislation from this most recent session, if there was anything that was concerning, anything that he was looking forward to. And he mentioned a concern within the law enforcement community about recruitment going forward because of some changes to PERS. When you are looking at recruiting healthcare professionals, doctors in particular, what do you anticipate? I mean, it hasn't gone into effect yet, but we know that it's coming. I guess it's July 1st when the new system goes into effect. Are you hearing about that? Is that a concern for doctors, nurses, physical therapists, et cetera, that may be looking at coming to work at UMMC?
So, the interesting thing is everybody's kind of on their own timeline and looking for different things. A lot of our recruitment of physicians and faculty, whether it's research faculty, faculty in the nursing school, faculty in the dental school, medical school, a lot of those recruitments come from out of state, actually. So, one of the first hurdles that we have to get over is just getting somebody here to take a look at us. Once we do that, they actually realize, boy, there are a lot of sick patients here to take care of, and especially if they love teaching, we have so many students, and they see great opportunities. But of course, the retirement options are all bundled up into that. So for some people, PERS is very attractive and it's a big draw. For other people that might be thinking, I'm just going to be here a few years, that's not as much of a priority. So it really depends on the individual. It's kind of all over the board for us.
Do you anticipate that increased salaries could make up for a difference in the future, if necessary?
Well, we always try to keep up with, market competitive salaries. We've do market analyses multiple times a year to look at our different types of employees. Remember, we have about 11,000 employees, so we're the largest employer in the state that is, owned by the state. I think Ingalls and on the coast is a little bit larger number of employees, but we're the largest in-state employer. And so we're always having to, look at salaries and other things and try to keep up with market. Particularly for faculty, they have a couple of options. They can go into PERS, they can go into ORP, right, which can be more attractive, although it's changing also.
It is.
But I think that we don't know exactly what the effect's going to be yet until it actually kicks in and we start hearing from some of these recruits what they think about it.
And when we do our market analysis, you have to think about, okay, like I just said with faculty, a lot of times we're recruiting and we're competing with people all over the country for those faculty members. So when you look at the market analysis for a certain type of faculty, it might be a national analysis as opposed to a southeastern region. When we're looking at the nursing market, our biggest competitors would be within driving distance, the local market. So even when we do a market analysis, it's always nuanced. It's not just a real straightforward, out of the box kind of thing, because in different components of our workforce, that means something different. What our competition is and who we're competing against to recruit in nursing staff and physicians and the whole spectrum.
Let's finish with the nursing school question. And I should know the answer to this because I live in Oxford, but there's been some back and forth. It's like the nursing program is on the Ole Miss campus. No, it's in Jackson. No, it's in Oxford. It's kind of back and forth. Where does that stand today in terms of the nursing program from UMMC? Is that
the
both?
Answer is all of the above. Yes,
okay.
yes. So our nursing program has been based on the Jackson campus for years and years and years, since 1958, actually. So
okay.
A few years back, I want to say it was 5, 6, 7, maybe maybe even 8 years. We started a branch of our accelerated nursing program in Oxford. That was our first piece there. But then just recently have added also a piece, the traditional program, we call it, sort of the 2+2, so that students can do their first 2 years at Ole Miss and then finish the second 2 years at Ole Miss. And both of those Ole Miss offerings have been wildly popular and have really contributed to the growth of our nursing school.
They like to stay there in Oxford.
Well, I mean, that's what I was going to get at. The 2 and 2 gives you the opportunity to keep a student on the Ole Miss campus for all 4 years.
That's
4
right.
years,
That's
yeah.
right. Ole Miss likes that, and the students like that too.
Well, I mean, I've got a friend from Birmingham who had a daughter, and that was the detraction, right? It was before that transition happened, and she ended up going somewhere else where she was going to be in the same place for all 4 years. Interesting.
Now
stuff.
they have that option.
Good stuff. Thank you so much to both of you for your time.
Thank
I know
you.
we covered a lot of ground. Always appreciate it, and good catching up with what's happening at UMMC.
You too.
Thank you. Thank you.
Doctors LouAnn Woodward and LouAnn Jones. Dr. Woodward is the Dean of the School of Medicine. Dr. Jones runs the Health Affairs Department as Vice Chancellor. Appreciate their time. We're going to shift from UMMC largely to the Middle East in the 8 o'clock hour because there is a lot to unpack from the last couple of days. We're back with you after this. Mornings with Richard Cross.